Is there any way I can get some insight on an audit situation? Established patient came in for earache. History documented was comprehensive. Exam was EPF, expanded problem focused. In the MDE, medical decision making. This was a new problem to provider with no additional workup planned, which is 3 points. The complexity and data reviewed is minimal. There were no labs or x-rays ordered. The risk was moderate. There was a prescription wrote for the ear. This is sort of a gray area. The presenting problem is straightforward, but the documentation supports moderate medical decision making. Should this be coded as a 99212 or a 99213 using exam and medical decision making as the components for choosing the level? First of all, not every auditor will audit a chart exactly the same way. So the question, I guess, is from inside your office, discussing it or amongst other auditors. And not every auditor will see something the exact same way. It doesn't mean that we're not following the rules. It just means that there are those gray areas, like you mentioned, where you can make a case for one side or the other. So what you may feel is a 99212, I may feel as a 99213. You didn't include the diagnosis with your question. I'm assuming it isn't earache. Probably the patient had an ear infection. So just based on the documentation you provided, yes, I would code the 99213 because he met those components that warranted a 99213. Without seeing all of the documentation, I don't know what the reason would be to do a down code, why you would go to a 99212. I think maybe it was the medical decision making that someone may feel that they need to go to a 99212, that you don't feel that it should have been moderate, that it should have been low, since all we did was write a script. But if you follow your auditing charts, writing a prescription is considered to be a moderate level. So based on just what you gave me, I would agree with the 99213 on that. Another thing that I feel like, documentation and exam and medical decision making has to be really, really bad for me to do a down code to a 99212. I mean, sometimes it's warranted, and I know that an ear infection doesn't sound like much, but if you're giving a patient an antibiotic, you do have things that you need to consider there for doing that. So I hope I answered your question.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.